Welcome. Today we are continuing with prostrate education. Last week we talked about prostrate gland is located just below the bladder and in front of the rectum. It's about the size of a walnut and surrounds the urethra. That is the tube that empties urine from the bladder. It produces fluid that makes up a part of semen. We know that as men ages, the prostrate gland tend to increase in size. This can cause the urethra to narrow and reduce urine flow. Once you are 40, all men, please listen, please go for your own prostrate gland health check. This is because the prostrate gland increases or enlarges as you age. As you enlarge, it constricts the urethra from allowing the flow of urine, so making your urine to either dribble or in some cases is totally blocked. And sometimes when the flow of urine is reduced or your bladder cannot really empty all the urine in your bladder, it could lead to infection. So when this infection happens, it causes inflammation of the prostrate gland, resulting from bacterial infection. So this infection could either be acute or chronic. So now, when this happens, it affects the man. It affects his sexual performance. It affects his health generally. When this prostatitis happens, the man is placed on an antibiotics therapy to try to clear the infection from his system. So we are looking at, as you are aging, you go for your prostrate specific antigen test, which helps to tell the state of the prostrate. When you go for it on time, they'll be able to capture it on time and give you the adequate or the appropriate medication to help you in managing it. So the risk of an enlarged prostrate really increases as the man ages. According to the American Cancer Society, prostrate cancer is the most common cancer among men, affecting 1 in 8 males in the United States. So by adding healthy prostrate-friendly foods to your diet, you may be able to reduce your risk of prostrate cancer. In addition to making dietary changes, you still need to see your healthcare provider for regular prostrate cancer screening. So the healthy eating you have to add at least 6 of these foods to your diet. Number 1 is tomatoes. This contains a powerful antioxidant called lycopene. Some research suggests that a diet high in lycopene may help to reduce the risk of developing prostate cancer. A review of 24 studies by researchers suggested that men that ate more tomatoes were less likely to develop prostate cancer. Lycopene may decrease cell damage and slow cancer production. Lycopene is an antioxidant, meaning it protects cells from damages. You can eat your tomatoes as raw or partly cooked, or in form of paste, or sun-dried tomatoes, or as a tomato juice. So eat more tomato-based diet, or add more tomato-based recipes into your diet. The second group of food you must add into your diet is cruciferous vegetables, such as broccoli, cabbage, cauliflower, lettuce. This one contains complex compounds that may help protect some people from cancer. You can also introduce legumes and soybeans. Legumes are a food group that includes beans, peanuts, lentils. Legumes contain biologically active plant compounds known as phytoestrogen. The National Cancer Institute shows that shows a link between consumption of soy and reduced level of prostate-specific antigen. Prostate-specific antigen is a protein produced by the prostate gland, and this prostate-specific antigen test measures the level of prostate-specific antigen in your blood and is used as a screening test for prostate cancer. You can also eat soursop. Soursop is known to be rich in antioxidants called phytonutrients that can help fight disease-causing cells and even certain kinds of tumors. Phytonutrients help to fight cancer, enhances eye health, treats a range of infections, it fights inflammations, boosts kidney and liver health, improves respiratory health, reduces stress, enhances gastrointestinal health. You can also eat avocado. Avocado is known to be rich in beta-sitosterol, a plant sterol thought to reduce symptoms associated with benign prostatic hyperplasia. Finally, eat onions and garlic. Onions and garlic is equally important to introduce into your diet. Research suggests that these measures may help lessen symptoms of benign prostatic hyperplasia. You avoid liquids a few hours before bedtime and when you are going out. Limit your consumption of caffeine and alcohol, as this may stimulate the urge to urinate. Eat a low-fat diet. Eat a large variety of vegetables each day. Eat a few servings of fruit daily and be sure to include citrus fruits. Participate in moderate to vigorous physical activities most days of the week. Maintain a healthy weight. Such healthy habits such as regular exercises, watching your waistline, eating vegetables and fruits, keeping an eye on dietary fat may help with issues with your prostate, as well as lower your risk of erectile dysfunction, diabetes, and heart diseases. All these things we are putting apart is to help you in healthy living. So imbibing healthy living lifestyle, healthy eating will help you reduce the risk of prostate cancer or benign prostatic hyperplasia. If you like our videos, kindly subscribe, turn on the notification bell so you get our videos as soon as they drop.